All right. Hello, everyone, and welcome to the very first DuPage ROSC Council meeting of 2025. My name is Jarrett Burton. I am your ROSC coordinator. If we could start by asking everyone on the Zoom component, please make sure that your microphone is muted unless it's the time for questions or comments. That would be a big help in cutting down on interruptions. Also, if you don't mind, the folks on Zoom, please put in your name, organization, or contact info in the chat. That helps us to take attendance and report back to our friends at the state. I'm going to share my screen real quick. All right. So if you are here for the very first time, I thought it would be helpful to give a short refresher on what a ROSC is and specifically what DuPage ROSC does. So a ROSC is a coordinated network of people and services who have come together to kind of create a better, more seamless system of care for individuals who are living with substance use and mental health challenges in DuPage County. We really rely on people with lived experiences to help steer the ship. So people in recovery, their friends, their family, their allies. We basically need people with lived experience to help build a more lasting culture of recovery.
Okay, thank you very much. I'll go ahead and be there on that date.
Richard, I love you. Can you mute? Thank you, sir. Actually, you know what, Richard, I'm going to give you a pass. You recently just got done with cancer treatment, so everyone give Richard a round of applause. And as somebody who went through a couple of years of cancer treatments, it sucks. It's not fun. So congratulations, Rich, on getting through that. So yeah, PLEs, people with experience, are really what we need to kind of build this more lasting culture of recovery in DuPage County. But overall, we can't do any of this without the participation of the people who come back and join us month after month. And we have a really, really amazing turnout here in person. We almost went through all the chairs, which is kind of crazy. For those of you, by the way, who have maybe been engaging with us over the past few months, you know that we recently brought on my awesome colleague, Annette Villarreal, who's been, honestly, no joke, like an angel from heaven for us. She is, well, has an amazing background in this work, you know, kind of specifically DV and other things, but the work that she's been doing for us with substance use and mental health, super important and really affords us the opportunity to broker resources and open ourselves up to the Spanish-speaking community, which was like a real blind spot in DuPage County. There was a lack of places that specifically were offering those services. So to be able to do that now is a really, really cool thing. So if you're somebody who works for an organization that could maybe use some help with some referrals, or you're maybe getting requests from people in the community who are primarily Spanish speakers and you need some help, don't hesitate to reach out. We're happy to try and assist with that. So why don't we take a look at today's meeting agenda and we'll kind of get started. So as always, we have a ton of meetings, upcoming trainings. We're going to go through all of those here at the beginning. Danielle Heffernan, who runs the DuPage RCO, will give her update. Our friend Danny Sorbis, who is heading up the Serenity House Coors Grant, will give a little bit of an update. And then Blake Warman, who works with us in the ROSC and the WhatsApp referral group. I think a lot of you are a member of that already. And if you aren't, we can kind of walk you through that process. Our friends from the Ecker Center are here, so Herbert, Strickland, and Daisy Silva. And we also have Alex Pulaski from the DuPage Health Department to talk about the DuPage Narcan Program annual report. And then anytime at the end, we will try and make some room for that. Before we kind of get into the meetings or trainings, though, since we do have a lot of new people here for the first time, I thought it might be cool for people who are maybe this is their very first meeting, they could introduce themselves. So much like the daytime talk show format, I've got microphones, and my colleague Annette is going to walk around. And if you were here for the first time, if you don't mind introducing yourself, if you're coming from an organization, you can tell us where you're joining us from. And yeah, that would be great. So if you're here for the very first time, if you don't mind, a show of hands, and Annette can make her way around.
Here. Uh-oh. Hi, everyone. Can you hear me? Hi, everyone. I'm Carolyn Shambles. I want to say, and I'm an alcoholic, but I am. But I'm with Summit Behavioral Healthcare. We have about 28 detox and residential treatment facilities all over the country. And I know while they're not in the area or even in Illinois, sometimes for a client to get out of state and be able to focus on themselves, to get better. It's fantastic. Some of them take Medicaid. We are in network with every insurance you can imagine. 4 out of those 28 are primary mental health, and that's huge. I've got a whole bunch of different specialties. Please talk to me. Again, I'm Carolyn Chambliss with Summit Behavioral Healthcare, and I'm happy to help at any time. Thanks.
Great. Glad to have you with us.
Hello, I'm Herb Strickland. I'm the Director of Substance Use Services at the Ecker Center for Behavioral Health in Elgin, Illinois.
We'll go
Yeah.
more through the Ecker when we get to you guys
Okay.
specifically.
Yeah.
So yeah, glad to have you with us.
Hi, everyone. Can you hear me? Is this working?
Mhm.
It doesn't seem
Yeah,
like
as
it.
long as the switch is on, they can hear you on this side. You just have to
Got
have a
it.
normal voice in here.
I'm Daisy. I'm one of the speakers today. I'm from the Ecker Center. I'm the Director of Crisis Services.
Glad to have you with us.
Hello, everyone. My name is Charlotte Blanks, and I'm the Health Insurance. Big news for us is that our inpatient programs are now in Blue Shield, which is covered lives here. So we're very excited about that. And we've got an upcoming CEU at our center on January 17th. Kelly Kitley will be presenting on alcohol use, misuse, and abuse. We'd love to see you there. If you want more information, please see me. Thank you.
Is the microphone switch on with the color and everything? Okay. I'm going to turn mine off because I think there was a little bit of some trouble hearing. So go ahead and we'll keep track online if it's starting to sound quiet again.
Hi, everybody. I'm Michelle Meyer. I am the Assistant Director for Community Health at the Kane County Health Department. And not long ago, we had our opioid task force meeting, and some questions got brought up about why Kane County doesn't have a ROSC. And we were thinking maybe we do need one at some point soon here. So we're here to just see what awesome stuff you're all doing and take it all in. So thank you.
To piggyback off that, I'm Kim Peterson, the Director for Community Health at the King County Health Department. Same thing. We're just trying to, we're sister counties, and we like to kind of copy you guys and see what other people are doing. So we're just really excited that Jared invited us and hope we can collaborate more.
Hi, everyone. I'm Sharon Cabrera. I'm the Substance Use Prevention Specialist at the Kane County Health Department, and I run the Narcan program, but in Kane County.
And then, hi, everyone. I'm Sarah Mendoza. I am the new Fatality Review Board manager at the King County Health Department. So I'll be putting a committee together there to look into overdose deaths and see what gaps maybe were in the system, and look into building new recommendations and maybe changing some policy.
I think that was it. So now you can switch that mic switch off. And then thank you for bearing with us with the audio getting a little quiet. I think we're good to go now. So I'm going to go ahead and share my screen again, and we're going to talk about some of the upcoming meetings, trainings, all that type of stuff. Let me go ahead and share this again. All right. So first thing, you may have heard the DuPage ROSC, as is every ROSC in the state of Illinois, is conducting a community survey, partly in collaboration with IDHS Super. The questions on our survey are really trying to align with the 5 priority goals of ROSC in the state of Illinois. So those are harm reduction, promoting medication-assisted recovery, so things like Suboxone, but also things like methadone, promoting harm reduction, ensuring effective service delivery, and really importantly, prioritizing equity. So the information that we're collecting in this survey, which is a pretty short survey, gets reported back to the state, but also it's used to kind of help us get a snapshot for what the recovery community in DuPage looks like, where are our strengths, but also where are the gaps in services and where can we identify those to kind of meet the needs that are in those gaps. I have physical flyers here, so if people want to take any of them, they can. And I also had the QR code for the English and the Spanish. When we did this 2 years ago, we had a Spanish version that had like, I think 1 response. We are already up to 6, so a 600 times increase. Really, really happy. Or it's not 600 times, is it? Did I make that up? All right, so I consider that a win already. But yeah, if you guys haven't taken this and you don't mind doing it, that'd be great. At the end of the meeting, I might put this back up just on screen, so if people didn't get a chance to take the QR code, they can. Our friend Bruce Seawick from College of DuPage, not only a great ally and friend to the ROSC, but a great human being and someone I consider a friend, will be back to give his presentation, What Have We Learned from the Psychedelic Renaissance? Bruce did this presentation for us about 1.5 years, almost 2 years ago, and it was like one of our most viewed videos on YouTube. I get a lot of feedback still from that presentation. And so I thought with, you know, legislation and possible legislation that's been out there about, you know, use of psilocybin and other psychedelics for treating trauma and other mental health challenges, it would be great to have him come back to give that presentation because it's now more than ever super, super important. So that's next Wednesday at 10 a.m. Those presentation series meetings are always on Zoom only, and they are completely open to the public. So if you are somebody, you know, are passionate about a topic that's on the recovery continuum and you want to present for us, please, we're always taking presentation ideas. We'd be happy to have you join us for one of those. Next month, Wednesday, February 19th, for the ROSC Council meeting. And I think we had to push it back a week because of Lincoln's birthday. Yes. So instead of the second Wednesday, it'll be on the third Wednesday. Our friends from Geode Health and Relief Mental Health will be here to give us some organizational spotlights. So we hope you can join us for that one. Coming up on Saturday, January 25th, from 6 to 9 p.m., we have the third edition of the DuPage ROSC and DuPage RCO game night. If you've never attended one of these, it's really, really cool. We actually do it in this room, and using this giant screen behind me, but also other TVs, we put up a bunch of like video game stations. We play like Mario Kart on this giant screen. It's pretty amazing. We have board games, cards, you name it. We really try to show people that sobriety is not boring. I hear that a lot from people in early recovery. They're worried about life is just going to be boring now. I guarantee you it is not boring. And we try to put on these things to make sure that people know there's events and there's people like them out there to come and fellowship with. So we hope you can join us for that. Couple meetings real quick. Connection Through Loss is our grief and loss group. We do it here at Serenity House on the 2nd and 4th Thursday of every month at 7:30 p.m. Our friend and colleague Felicia usually runs those. If you or someone you know has experienced loss, and I think all of us in this room probably have, and need a group to kind of help process that and have some fellowship around you through that process, you're more than welcome to join us on the 2nd and 4th Thursday. Speaking of friends and family, we also have a friends and family smart recovery meeting on Thursdays. Friends and family especially are one of those groups that I think a lot of times gets forgotten about or sometimes gets overlooked. Obviously, the people who are in recovery themselves are the ones who are kind of going through that recovery process, but family really, really needs support, whether that's through educational stuff or whether that's just through having somebody to talk to about the process. What we would love you to have come and check out our Smart Recovery meeting for the Friends and Family, Thursdays, 6 to 7 p.m. Danielle Heffernan, come on down. You're the next contestant on The Price is Right. So Danielle's going to talk a little bit about an event that's coming up, and then I also have, I think, a couple of your meetings up too. So I'm going to turn it over to Danielle.
Hey, everybody. Oh, sit. It's kind of face down. So I am the coordinator of the RCO. What the RCO is basically we support people in recovery from either substance use or mental health challenges. We do that by a whole bunch of different ways, whether it's peer support, like recovery coaching. We do prevention work in the schools and with the teens. We put on fun events, harm reduction, Narcan training, stuff like that. And speaking of fun events, this Saturday we have a recovery yoga class. So that is this Saturday, January 11th. It'll be from 3 to 5 p.m. right here in the big hall where we're at right now. There'll be a bunch of people. It's beginner friendly. So we would love if you would come. Trinity Hamilton will be the facilitator or the yoga instructor for the event. And we're really excited. It'll be loads of fun. And then we also have a smart recovery meeting that we offer at Stony Brook Center right in Wheaton. It's every Wednesday at 1 o'clock, 1 to 2. We would love for you to join that as well. And then we also have our Narcan training. That is the third Thursday of every month at 12:30. It's on Zoom. And it's really great if you just need to refresh on Narcan. We also go over some current trends, the overdose trends from right now. We don't have the 2024 stats yet, but we have the 2023 still. And yeah, we would love for you to join us on that as well. Thank you.
Thank you, Danielle. If you would like to come and see me fall down doing the most basic of yoga poses, come on Saturday. Should be fun. Next up, I want to invite my friend and colleague Danny Sorbis, who heads up the CORS grant through Serenity House, to maybe give a short overview of what CORS is, and then I've got a few meetings that you guys do through CORS that I can pull up during that. So I'll just go ahead and pull the first one up. If you're switched on, you can go whenever.
All right, thank you, Jarrett. I'm going to apologize to everybody ahead of time. My voice goes in and out or I cough. I'm getting over an illness. But CORS stands for Community Outreach Recovery Support. I was blessed with the opportunity to coordinate it starting July of last year, I guess, July 2024. And what our main focus is helping those who are unhoused or homeless, or those at risk of being unhoused, those who have opioid or substance use disorders or other mental health challenges that go along with it, and those who are at risk of medical complications, overdose, and incarceration. In order to do that, we provide harm reduction training and distribution. We do referrals. Blake will speak shortly about the referral hub, which we utilize a lot for that, not only for just getting people into treatment, but for coaching services as well. And we have made many partners. I know Jared has on the screen right now a virtual refuge meeting. So we have virtual refuge meeting every Saturday from 10:30 to 11:30. With our grant, the way that we are, we're not just concentrating on DuPage, we're concentrating on Lake, Lake, McHenry, Kendall, Kane, DuPage, Will, Grundy, and Kankakee. So we're in a lot of different counties. The virtual meetings like the refuge and the smart meeting here allow us to reach as many people as possible. And even if you're not part of those 8 counties, you could be Cook, you could be a different state. We don't care. We just want to help. Recovery knows no bounds. There's a hybrid meeting that's virtually and also here in person at Serenity House every Thursday, run by our colleague Jim Murphy. I highly encourage, if you know any veterans who can use support, he's a veteran himself, to come join in. It's a great meeting.
If somebody wants peer services through the CORS grant, how do they do that for you?
Well, I'm going to put my email here in the chat, and we can set up a meeting to discuss what it is they're looking for. But basically, our coaches can reach out once we've identified those in need. They will set up a call with them. If they're able to meet in person, great. If not, they can do something over the phone or via Zoom, communicate via email. There's some brief intake forms that we have to fill out, but we will connect them with a coach that we feel is best suited for them. We also have coaching biographies that we distribute. So a client can look and read up and say, hey, Jarrett looks like a good guy. I want to talk with him, or vice versa.
All right. Thank you, Danny. And again, just make sure you put your email in the chat and we'll go ahead and get people connected that way.
Thank you, sir.
All right. Next up, Blake, come on down. You're the last contestant, at least for this round. As I mentioned, Blake Warman does a lot of help with us through the ROSC, especially through the WhatsApp referral hub. And he is here to give us the monthly rundown from that. So Blake, go right ahead.
All right, everyone, very brief updates so that we can move on to our guest speakers. We started off the year strong with a conservatively tallied 63 referrals for the month. We have a total of 133 members with 5 added over the last month. Our winner with the most referrals provided was Becky Sadler. I will be reaching out to you to email you your gift card. With the referral hub, I will hopefully have a new update to the referral list to send out towards the end of next week. If you do not have a copy of that and you would like one, I will put my email in the chat and reach out to me and I will get you that. Or if you'd like to be added to the referral hub itself, you can reach out to me there and I'll make sure that you are on.
Like, and we had to retire John Schoes from winning. He was like, how many did he win? 5 or 6? Yeah. We were hanging his rafter or the jersey in the rafters here. Yeah. So yeah, thank you everybody who takes part in that. It's been a really, really helpful service. So I'm gonna stop my share here for a second. I realized I asked all of the people like in person to introduce themselves, but I didn't ask if there was anybody on the Zoom for the first time that wants to introduce themselves. If there is, you can maybe put up your little digital hand. If not, I'm looking through here. I don't know if I see anybody on the first time, but if I did, I will give you the time a little bit later. Going once, going twice. All right. Thank you, everybody. So I do want to bring up our very first folks, Herb and Daisy. You want to come on down here? Herb Strickland and Daisy Silva are from the Ecker Center for Behavioral Health. We got a chance, we meaning like a group of us, had a chance to go over there. Oh, wait, hang on one second. I do see a hand up. Melissa, I'm sorry. I didn't see it. You go ahead and introduce yourself.
It was my fault. I'm not great with technology. So my name is Melissa Jankowski. I am a new program manager with the College of DuPage for special student resources. So essentially, if a student needs resources such as like housing, food, signed up with insurance, I'm the go-to. So right now I'm just trying to learn about all of the different resources in DuPage County. And Bruce actually told me about this ROSC. I've been on other ROSC committees in Champaign, Illinois. So I'm very familiar with like the structure and everything, and I'm really happy to be here. So thank you so much.
Glad to have you with us. Thank you. Sorry, I didn't see your digital hand earlier. Yeah, but glad to have you with us. No, what I was saying was there was a group of us who went over to the Ecker Center, I think it was a couple of months ago, to take a look at all of the really, really great services they're providing for the people next door to us in Kane County. So it was great that we're able to actually have them here to be able to take a tour and check out the services and the things that we do here. So really, really excited to learn more about the Ecker Center if you aren't familiar with it, and kind of give a rundown of the services and kind of what you guys do over there. So if you don't mind, I'm going to share the screen again. I'm going to put your website up there while we're chatting with you. So Herb, if you want to start and then introducing yourself, and then I will turn my mic off so everybody online can hear you.
Hi, as I mentioned, Herb Strickland. I'm the director of substance use services at the Ecker Center for Behavioral Health. And we are a community behavioral health center. The Ecker Center goes back actually to the mid-1950s. We also have a component, the substance use component was previously known as Ren's Addiction Services, and a few years back we combined services and became the Ecker Center for Behavioral Health. Currently, we are really excited about a process we're going through to become a certified community behavioral health clinic, which is going to help us to expand our services and meet the needs of people in the community even more so than we are doing now. And again, we're very excited about that. Part of what that allows us to do, both for mental health and for substance use, is it allows us to do same day walk-in assessments for both mental health and for substance use. I can speak more to the substance use side. Daisy can probably talk a little bit more about the mental health. But Monday through Thursday between noon and 4, people can present to our grandstand location. There's a brief process of going through our intake department to get things set up. And then you would go to either a mental health provider who would do a mental health assessment, or a substance use provider who would do the substance use assessment. And following that, we can get you enrolled in one of our programs that we offer. If you require a service that we don't offer, then we do help with the connecting you with somebody who does offer that. And I could move next into some of what we do with the substance use. So we offer both prevention services and the clinical services for treatment. On the prevention side, we have an ATOD program, which is alcohol, tobacco, and other drugs. And with that program, primary focus is it goes out into schools, middle schools, junior highs, and high schools, doing an educational program on drugs and making healthier decisions. And we have another program that we work with along with Kane County. So it was really nice to see many of those folks. They are a tremendous partner for us, and it's the opioid overdose prevention program. With that program, we have been able to open up recovery cafes, and we have one in our grandstand location at 1845 Grandstand Place in Elgin. We have one in St. Charles at our location there, and also one at Hanover Landing. It's a place where people can go and meet with a recovery support specialist to explore recovery, to find out about things, to get assistance in a variety of areas. There's no pressure, and it's just kind of a soft and gentle way of getting into recovery for people. We also do a lot of Narcan training through that program. We do some police ride-alongs, and one of the things that we are really excited about in regards to our recovery cafe is we are looking to partner with other agencies, and we're doing mobile cafes. So we go to different locations, and we'll usually get room at one of these locations, and they host us so we can provide those services at those area spots. For treatment-wise, we provide services for adolescents at the outpatient level of care, and for adults, we provide services at the outpatient level of care and intensive outpatient level. We also have medication-assisted recovery. We use Vivitrol and Suboxone, but we also can use others like Camprolin, things like that. So we do try to address all the treatment needs that people have for those particular issues. Support group wise, we do hold Smart Recovery. We have a group that meets at Grandstand on Tuesday evenings. We have one that meets at Hanover Landing location on Thursdays. We have a telephonic one that meets on Mondays, and we're really excited to start a Spanish-speaking smart group on Saturday mornings from 10 a.m. to 11 at our Grandstand location. And we have some amazing counselors. We get people in really quickly, which is very important when it comes to substance use treatment. And, you know, we're just looking for ways to partner with people and get the services that we provide to connect with as many people who are in need in the community. So
I have one question before we go to Daisy. So I'm really intrigued by the idea of mobile cafe.
yes.
So is that going to be like a larger like food truck size thing, or is it literally just like the cafe is kind of the slang term for we're going to go out and meet people like where they're at in the community?
I love the idea of the food truck that may be coming in 2026. But basically what it is Annette Workman, who's a recovery support specialist. She goes to the location. We've been going to the Elgin pads. We've gone to the Salvation Army in Elgin. And we're in the process of looking at Elgin Community College. And we go there and we kind of replicate the fixed locations that we have. We provide light beverages and things, and Annette just makes herself available to people who are interested. So we're trying to go out into the community and meet people to make it as convenient as possible to start the recovery journey.
Amazing. Amazing. Yeah, and we may have some questions for either one of you at the end, but yeah, we'll get over to Daisy Silva, who directs crisis services. So walk us through what crisis services is at Ecker Center, and yeah, how people can access that if that's something that they need.
Yeah, so we have 5 different crises programs at the Ecker Center. They include our psychiatric emergency program, which is located at 2 of our local hospitals, St. Joseph's Hospital and Sherman Hospital. We have crisis counselors that are there within the ED, waiting for clients to present themselves. If a client is screened at the ED and determined to have a mental health need, they would then be seen by our mental health counselors that would conduct an assessment and determine if the person is safe to go home, what level of care they need, and then they would either provide referrals if the person is not requiring inpatient treatment. If the person does require inpatient treatment, they would locate a facility and then arrange for that person to be admitted. We have, so that was the psychiatric emergency program. We also have another off-site crisis service we provide is our local partnership with the Elgin Police Department. It's called the Collaborative Crisis Services Unit. So that is crisis counselors that are stationed at the Elgin Police Department and ride along with officers to address dispatch calls. So someone calls 911, they're in need of services. They're typically looking for law enforcement, but if it's evident or even if it's suspected that there is a mental health component to the call, we might have a crisis counselor go out. This could also happen if a crisis counselor isn't immediately dispatched, but later on scene, it's determined that the caller would benefit from speaking with a crisis counselor. One can be sent out. So to get connected to that program, you're calling 911, or if you have the direct line and you have a prior relationship with the Collaborative Crisis Services Unit, you can call them directly. We also have 3 on-site crisis programs. They include our crisis residential program, our crisis stabilization program, and our mobile crisis response team. So I'll start by talking about the crisis residential program. So that is a short-term treatment program that is located on site at the Ecker Center. The program primarily focuses on stabilization, medication stabilization, symptom stabilization. Individuals that are in that program stay on site at the Ecker Center for 3 weeks, during which they participate in a set programming that includes PSR groups, that includes participating in daily chores, participating in dinner responsibilities. They do have to meet with a prescriber weekly, and they do have to be willing to be 100% medication compliant. Throughout the time that they're with us, the staff working with them are making note of their symptomology changes, different behaviors, and reporting it back to our nurses, who then communicate with a psychiatrist at the weekly appointment to assist with adjusting the medications. That program is fairly popular, and I'd say it's pretty effective. Sometimes the wait list is long because we do have, there is a lot of interest. There are other crisis residential programs that are somewhat local. I know there's one in DuPage County, but ours is 3 weeks versus I know that a lot of the other ones are shorter term programs?
3 or 4 days sometimes.
Yes, yeah.
So I can just say, just offhand, that was kind of a gap that we experienced in trying to find referrals for people, and some of the people in our group can attest to that, because we can find some spots for substance use folks like pretty easily nowadays, but for the people who just needed, like, I need some medication stabilization, I need to be somewhere safe for a few days, we were still running into that issue where like there wasn't enough beds in DuPage, or so to be able to stay somewhere for 3 weeks is like massively important.
Yeah, we do see a lot of progress, not just within treatment, but individuals that are staying within that program are able to make progress towards their own individual goals because it's a lengthier stay. It's a 8-bed program, and it's co-ed. Sometimes it ends up being all females, sometimes it ends up being all males. It's really just dependent on who's on our wait list. There is no catchment area for that program. Someone could live in Chicago and still be accepted. And so if you have any referrals, you can send them our way. That's our residential program. And then we have our mobile crisis response team and our crisis stabilization program that provide some kind of the same service. So both programs aim to identify individual needs, assess for risk level, and then make a level of care determination. One of the key differences between the two programs is one is stationary. It's located at Ecker Center, and the other one is mobile, so they can meet individuals anywhere in the community, wherever they're at. I don't know if you had a question you were gonna, no? Okay. Okay. So our mobile crisis response team, in order to get connected to them, someone would just call our crisis line. And we're available 24/7, 365. So someone would be available to pick up the call, and they're able to provide crisis support over the phone if someone isn't interested in seeing us in person. But ideally, our goal is to get out there in the community, lay eyes on someone, and support them in person. If they're outside of, we do have a catchment area for that service. So if they're outside of our catchment area, we would provide a warm handoff to whoever the mobile crisis provider is with it, where that person is located. If our mobile crisis response team does go out and determine that someone is maybe needing additional supports, they don't necessarily qualify for hospitalization, but we don't feel great about just leaving them in their current setting, our mobile crisis response team can transport them to our stabilization program. And that is also a 24/7, 365 service that's located at Grandstand. It's meant to be very low barrier, so you don't need to be a registered client to receive service. We accept walk-ins. You don't have to have insurance. You don't need to have identification. You don't need to live in a catchment area. You don't need to be documented. You don't need to be able to pay for service. You don't need to even tell us who you are. Anyone can come there. You do have to be 18 years or older. We're working on a child version of that same program, but it's still just an idea, but hopefully something that comes to fruition in the near future. So anyone can come into that program as long as you're 18 or older and experiencing a mental health crisis. Our crisis counselors within that program would do a lot of the same things that our mobile crisis response team does. They would conduct a risk assessment. They would help the individual identify immediate needs. We would come up with a care plan. If the person is presenting as a potential risk, we would probably encourage them to stay within the program. They can stay for up to 23 hours if it's deemed appropriate. So one exception to that could be someone that's coming in and they're primarily looking for housing support. We're not a housing service. We address mental health crises, so not homelessness crises. While they're with us for those 23 hours, we can provide some case management services. We can provide brief counseling. We can assist them with identifying resources, provide them with referrals, conduct warm handoffs. It is fairly open. The types of services that we would provide, the individual visit is tailored to what the presenting problem is, so it's fairly flexible. So yeah, that one's up to 23 hours. At the end of the 23-hour stay, we would have to make a determination on whether that person is safe to go home or if they're requiring a higher level of care. All the crisis programs work closely together, so we're often moving an individual from one program to the next. So what you could see is a person goes to the psychiatric emergency program, but they're not meeting criteria for hospitalization. So they're then transported via Uber to the Ecker Center for Crisis Stabilization. And then maybe from crisis stabilization, they're admitted into the crisis residential program. Or another example could be someone calls from the community needing crisis support, mobile crisis goes out, and they don't want to leave the person in their current setting. So they transport them to the stabilization program. And from there, they could go to the residential program or the psychiatric emergency program. There is no wrong door to accessing crisis service. You had to ask, like, how do you get connected to us? As long as you reach out to one of the services, we will find what the most helpful program is, and we will get you connected, whether that mean transporting you or conducting a warm handoff via phone or in person, whatever it is that we have to do, we work together to ensure that the person wanting service receives care.
Wow, you guys are very comprehensive. Thank you very much. That was a great rundown of services. I do need to get to my next presentation. I want to give, though, a couple of minutes here in case there are any questions about the services or the stuff that y'all provide. If there is someone on the digital that has a question, again, you can raise your hand, or if there's somebody here in person, may make sense to talk after the meeting so we can actually have a conversation. But otherwise, just the fact that we know that we can send people for crisis services or any other services without that catchment is massive. Just because of the sheer amount of people who need those types of services. Doesn't matter what county it is or geographic borders, we need it across the board. So thank you both so much. It was great to have you here. And yeah, we'll talk more specifically after the meeting. So I'll take that microphone back from you. Thank you, guys. All right, next up, I wanted to throw it over to Alex Pulaski, who does Community Initiatives Coordination with the DuPage County Health Department. Alex, before we get into it real quick, I just did want to announce to everybody, because I don't think I've kind of made like an official announcement, but we're going to be continuing the work that we've done with the DuPage Health Department over the past couple of years in various areas, specifically harm reduction. So we're going to continue to work with them on providing Narcan wall boxes, trainings, test strips, all that type of stuff. But also through the BASE grant and the Prevention Framework grant, some cool prevention work with area schools, but also looking at specific harm reduction for folks who maybe are a little bit younger, right? Who we might need a specialized training for, or for alternative schools, which a lot of times, you know, gets forgotten about. So just excited to announce that, Alex. We're always happy to work with you, and a great collaborative partner. So I'm going to go ahead and throw it over to you. You should be a co-host, so you should be able to share your screen.
Perfect. Thank you. I will share my screen now. 1 second. All right. Let me move everything around. Hold on. All right. Hello, everyone. My name is Alex Pulaski. I am a Community Initiatives Coordinator with the DuPage County Health Department. Really excited to be here. I am today presenting on the 2023 DuPage Narcan Program Annual Report. I just want to preface that this report isn't 2 years old, now that it's 2025, which is crazy. But we kind of do our annual reports the year after. So we just finished up this report in November, so it's hot off the press. So I'm really excited to share it with you all today. Some of you may know the DuPage Narcan program through the Narcan wall boxes, trainings, mail out program, all of those kinds of things. But this is kind of our 10-year anniversary, so I'm really excited to share our annual report. All right, so for kind of when I was outlining the report, I really wanted to include what the Narcan program is doing. So I, at the top, kind of wanted to do like, what are we doing, and kind of all of the components of that. So you'll see the first one is expanding availability with the free naloxone access map. So this is in partnership with the DuPage ROSC. So around the community, you'll see a variety of either vending machines or naloxone wall cabinets. You'll see kind of a list here, and I know this is really small probably for folks who are sitting in the room, and I can share this report with Jarrett after to send out. But this is a list of all of the locations in DuPage as of November. I know that there's a couple sites that were added since then, but these are all the sites that have naloxone wall box or vending machine. And I know some locations don't have either, but they have Narcan available. You just walk in and ask, and no questions asked at all. And then this QR code, obviously this report is mainly made to be shared digitally, but there's also physical copies as well. But if you scan the QR code, you will see the Google map with all of the access sites around DuPage. So that's going to be constantly updated rather than the list that's already outdated for 2 months, which is great though. All right, so number 2 is the overdose fatality review team. So this group is really, the goal of the group is to better understand substance use and kind of learning how to prevent those gaps and barriers of a decedent. So really focusing on ways that we can prevent those in future overdose cases and kind of close those gaps in our overdose response system. So that's a group that isn't, a lot of the folks who are working on the DNP are also involved in the overdose fatality review team. Number 3 is the mail out program. So during COVID, we started mailing out Narcan to people in the community, but also statewide, because our grant allows us to mail Narcan across the state, which is great. So by the way, if anyone is in Southern Illinois and wants Narcan, definitely have them reach out to us. I will put the link in the chat afterwards, so you can have that mail out program link there. The next one is new partnerships. So we have developed numerous partnerships with schools in the last year, and really continuing as Illinois passed a new law that all public schools in Illinois have to have Narcan on hand. So lots of schools were trained, and a lot of schools have Narcan on hand now, which is awesome in case of emergency. And then over here, number 5 is all the various campaigns that we had over the year. So you'll see Jarrett's face on one of them. This campaign was really successful, and really all of the campaigns in total, you'll see 1.6 million impressions, which is awesome. And thank you, Jarrett, for being on that campaign. You saw these probably digitally. And then this was also the campaign that was on the gas pumps and out in the community, which was awesome. Over here, you'll see Dr. Richard Jorgensen, which was our coroner for the last 12 years. I really wanted to include him because he was a huge part of the DuPage Narcan program. He was there since the beginning, so I, of course, wanted to include him there. I included a snippet of his, a quote from his press release, and it really, I won't read it to you right now, but it's basically saying, through the years, all of the hard work, the 24% decrease in drug overdose deaths, but basically the work doesn't stop here. We have to continue fighting the opioid epidemic. So I encourage you to kind of read through that. You'll see more data on there, but super great that we had him with the DuPage Narcan program. And then on the back, this is also they're super small, so I understand if you can't read it. But at the top, you'll see Jarrett wanted to be a part of this annual report. So I was like, yes, let's have someone who is a huge partner for the DuPage Narcan program. And so he was on the back there with his quote. Thank you, Jarrett. And then over here, you'll see kind of all of the milestones over the last 10 years of the program. Again, really small, so I don't think you can read that, but kind of all of the different accomplishments, milestones since 2013. You'll see the first one here is county leaders determine that deaths due to opiate overdoses are an epidemic and must be decreased. And then you'll see the mail out program begin and all of the kind of activities that we did over the years, which is really cool to see kind of all in one spot. And then you'll see some years don't have anything. That was just kind of, you know, nothing huge to report on. And then at the bottom here, if you're interested in more, not only a full list of partners, but resources, trainings, that mail out program that I said, and also we have our naloxone access map on there too. So I can also drop that in the chat in a second, but this is kind of the DNP annual report in a nutshell. Like I said, I will share this with Jarrett so you all can kind of see it more clearly, but also just read through it. It's really kind of interesting to see how the program has evolved.
Yeah, and as I said, when we had the stigma reduction campaign, when it really kind of kicked off after the first, couple months, if you've never seen your face on a gas pump, it's super weird. It's very surreal. You get people you haven't talked to in like 3 years saying, "Hey, look," and they'll send you a photo of yourself on a gas pump. It's very interesting. But yeah, I think the one thing, Alex, that I want to touch on, and Dr. Jorgensen kind of has said this in this quote, but also when we talk in person, which was, yes, there was a 24% decrease from 22 to 23. However, you can see that 114 is still kind of towards the top as far as, fatality deaths from overdose. So while it's amazing we've been able, as a community to pull together to get that number down, we have to just keep getting it further and further down. And I think, by having so many places in DuPage County where people can, no questions asked, walk in and get Narcan is a pretty great thing. I always harp on this, but I don't care. It's an advocacy thing. I think it's great that Narcan is available over the counter. If you don't know how much it costs, it's $45 per box of Narcan. And the people who need that the most do not have $45 to spend on it. So, the more that we can do to make sure that Narcan, is free, easy to access, and importantly, people should be able to remain anonymous to access it if they want. Because there is still stigma attached to Narcan, if you can believe it. We've had events where we've gone out and had tables with Narcan, and when people who don't know what it is, sometimes they'll ask what it is, and we'll say, "Oh, it's Narcan. It helps, reverse overdoses." They jump back, like they think that that's like they touching the box is going to cause something. So there is still that stigma even attached to overdose reversal. So yeah, thank you, Alex, for all the awesome work that you guys do. HopeDuPage.org, is that it? .org?
Yes, dropping it in the chat now.
Okay, because there's that map or access to that map of DuPage at that website, so you can see. I think we have up at least 10 boxes, one vending machine, and then that's not counting all of the stuff that you guys did before we even came along. So there's a lot of great access to Narcan, more and more in our county. So let's chip away and make sure that harm reduction is like not a bad word in DuPage County. So thank you, Alex. We've got about 7 minutes left. So with that time, if anybody has any type of, event coming up, or if they have a new program that they're excited to promote, or if you are looking for collaborators, are you running a new program and looking to hook up with some people to get some things started? This is that time where we kind of spotlight those things. So if anybody on the Zoom end wants to do that, you can put your hand up. And if there's anybody in person who wants to do that, you can put your hand up and we'll do the game show thing. So I see Mark Matthews. And I'm going to turn mine off and yours on.
Sir. Hey guys, my name is Mark Matthews. I'm a CPRS, CRSS for Greater Family Health. We have 11 locations. We're now partnering with Kane County Health Department, so it's so good to see Michelle and Kim and Sharon. And yeah, we're just really excited. Greater Family Health was kind of on the front lines or cutting edge of offering not only medically assisted treatment, but peer support. I was hired on almost 5 years ago, and we offer peer support services free of charge to anyone 18 and over. And again, getting to now partner with outreach for the opioid task force and getting real involved in Kane County, which has been pretty much our staple, our Elgin location, is really exciting. So I've said, again, I was here at the inception of this ROSC. I got to watch how it looks when someone like Jarrett puts an immense amount of hard work into it, and we all collaborate and de-silo None of us are competing. We're all doing the same deal together. So I am putting the feelers out there. Please, I could use your collaboration, probably much more than you could use mine. But again, after this meeting or anybody online, please feel free to put your information, and I will also put mine in the chat. So thank you guys.
Thank you, Mark. Anyone else? In person first? She's going to take the game show mic around. When you get back there, I'll turn mine off. If you don't want to be seen, you can hang in there too.
I'm good at a distance. Kim Peterson, King County Health Department. So most of the things we're doing are similar to everyone, but this is one unique thing that we have coming up that we really need help with. We're hoping to submit it as a peer-reviewed study essentially as well. So we are using ARPA funding to do medication-assisted recovery trainings for physicians. So we have Dr. Holtzford and another Dr. Verma, I believe, who both work in DuPage County, and they will be training cohorts of physicians. These can be general practitioners. These can be ER docs, you know, the folks that aren't really comfortable prescribing these types of medications. You know, and our goal is to destigmatize, again, continue to destigmatize these things where if you're at your regular doctor and they know about this, you know, they can help you through it. They can prescribe it to you. You don't have to go to a special clinic or do this or that. We'll have that as well. But so this program, we're looking for, I think it's 40 physicians that are interested, and it will be two different time commitments. I think they're half-day trainings, and then one follow-up training like several months later to just get some more feedback on that again, but just to train in the protocol of prescribing these kind of drugs like buprenorphine, and how to implement that in your practice. And again, we'll be turning this into a peer-reviewed study, hopefully, so other folks can build models off of this. So I guess the ask is, if you guys know physicians, those GPs are hard to get in with. You know, we know some of the big names in addiction and things like that, but really the people we need to reach are the ones who aren't familiar with this. So if you know physicians, if you work with physicians, if you have contacts in the ER or other prescribers, physician assistants, nurse practitioners that would be interested in this, please send them our way. I will have Jarrett share the person that's running this program is going to be Tina Coral, our health promotions manager. So I'll have her contact info there, because we're just afraid with the physician's time, and we were going to pay them $400. So don't forget that. We knew that we wouldn't get them. Holtzford was like, you need to do a stipend. So we will be paying them each $400 in a gift card, unfortunately, because, you know, the funding. But so please let us know. Or if you have ideas of how we can reach more physicians, that would be great.
That's such an overlooked important thing. Like, as someone, I can speak from experience from years and years and years ago when I was trying to get on medication assisted recovery, and there was any number of doctors who just didn't know what it was, and when you'd ask about it, they would kind of shake their head and look confused. So to get more people trained is great. So yeah, we'll definitely share that information. Anybody else? We got 1 minute left. All right. Well, thank you, everybody. Thank you to Herb and Daisy from Ecker Center, as well as Alex from the DuPage Narcan program and the health department. Just a reminder, our presentation from Bruce Seawick on psychedelics is next Wednesday. And then next month on the February 19th, we're going to have our friends from Geode and Relief Mental Health talk about their services. And yeah, we're always looking for presenters. So if you're somebody that wants to present, either on your organization or something a little bit longer, you can do that. Sarah, did you want to share before, or do you want me to just put that in the chat? I'm seeing some stuff show up now.
Sorry, yeah. So we have a webinar coming up with in partnership with Prevention First. Next week, I put it in the chat. I don't want to respect everyone's time. I see it's 4 o'clock, but it is free. And it's a presentation that we actually presented at a conference a couple months ago. And it was received so well that they want us to make it available for everyone to join in on. So Yeah, free for all.
Excellent. Thank you, Sarah. We'll definitely share that. So yeah, we'll see you either next week or next month. And if you haven't yet, I'm going to share one last time just for the people on the Zoom that QR code for our survey. So you can go straight from here into doing that if you don't mind. Otherwise, yeah, we'll see you next month. Thanks everybody for coming month after month. We'll see you then.
Take care. Thank you.